All righty. Well, listen, I want to welcome everybody back for our second week of the Start or Sit podcast. Unfortunately, today you guys are stuck with just me talking. This is Dr. Hawkins from Washington Orthopaedic Center. Unfortunately, Shannon's unable to join us today. So I will be taking us through discussing some of the injuries coming out of week 3 and going into week 4 of the NFL season. This is a tough time of year. You don't want to see big injuries happen. And unfortunately, we're starting to see some of those things occur. And they're going to start making a difference for your fantasy teams as well. So we're going to kick it off with somebody that's going to be a quick answer with regards to their availability, but it's important for us to talk about it. And that's the wide receiver from the New York Giants, Sterling Shepard. If you had the chance to watch their Monday night game, he was having a solid game, and he was just running out a route towards the end of the game and just immediately clutched his left knee and went to the ground, and they were on the field right away. Now, he's a bit of a tough luck situation. He was coming off of an Achilles rupture last year, and he was getting back to his regular form. And what he suffered at that moment is he tore his anterior cruciate ligament in his left knee. So this is one of those tough situations where it's a non-contact injury. It's in a wide receiver who requires a lot of velocity and agility to move. And it happened on the same side that he was recovering from, even though he was back playing. So as Shannon would say, this is part of the kinetic chain that physical therapists take care of. And he suffered this injury probably in part due to the fact that he has still not fully recovered strength from that Achilles rupture and was relying a little too much on essentially controlling his speed and his deceleration through his knee, and that's what caused the ligament to rupture. So with regards to Sterling Shepard, he is obviously a sit. He is done for the season, and this may be, unfortunately, the beginning of a downward spiral for him with regards to his career. He's 28, 29 years old, and this is actually, I believe, his third major injury he's had in a short span of time. Okay, the next one out there that we'd like to talk about, which again, we're starting to get into some bigger injuries here, is the quarterback of the New England Patriots, Mac Jones. He had an injury again late in the game. He went down with some contact being tackled, and he immediately was essentially hobbling off the field as though he had sprained his ankle. So they did the typical workup for him afterwards. They got him an MRI, and they determined that he has a high ankle sprain. Now, for those of you who've listened last year, a high ankle sprain is a situation where you not only injure the ligaments at the ankle level, which are what holds the foot bones to the lower leg, but you've also damaged the tissue that keeps the two large bones in your lower leg, the tibia and the fibula, stabilized. So now they want to spread apart when you walk. And so that's a bad injury to have. And so sometimes a high ankle sprain is rested in a boot for 4 to 6 weeks. They have decided all indications are that he is actually going to undergo surgery for this. So a lot of people ask, why would you do surgery for this? Well, if you remember, another quarterback who's in the NFL now, Tua Tagovailoa, when he was at Alabama, he had this injury, and they actually had surgery to put a piece of wire. It's essentially called fiber wire. It's actually like a heavy suture material between those two bones to hold them together and let them heal quicker without stressing it. So I believe they've decided to do this surgery to hopefully actually rehab him a little quicker. So it's an unusual situation where he is having ankle surgery, but he may actually come back quicker. This may be a 2 to 4 week recovery, depending upon his fitness and his strength, as opposed to a 4, 6, or 8 week recovery. So when Tua had this done at Alabama, they actually had him back out practicing in 2 weeks. I believe he was playing at 3 weeks after this. So Mac Jones, for this week, he will be a sit. But We need to see how he's practicing 1 week out. If they're already having him throw a ball, that's a good sign that this may just be about a 3, maybe 4 week injury for him to return, even though he had surgery. All right. The next person we're going to touch on is another big name person for people who have fantasy teams. That's the running back for the Minnesota Vikings, Dalvin Cook. If you watched the game, he came out at least one time after a hard hit, got up, holding his arm, and ran into the pop-up medical tent. They checked him out, and he returned to the game. So for those of you who are wondering what's going on with him, he is actually nursing a shoulder that is unstable. So he has likely a labral tear in his shoulder that is causing that shoulder to slip out of joint. He decided against doing surgery in the offseason with the idea that he would simply work on keeping his arm strong and try to avoid contact that would cause the shoulder to slip out. Now, we're only 3 games into the season, and he's had to come out and go to the tent a couple of times. So this is going to be a hit or miss situation. He is probably going to continue to play every week. And as long as he doesn't fall hard or fall wrong on that shoulder, he will probably continue to be very productive. So I would play him if you have him, especially if you've got a sort of a very deep league where you need people to bring you points. I think he's worth the risk to continue playing. But he is going to be every week, you're going to be rolling the dice on Dalvin Cook. Is he going to get you 5 or 6 points? Is he going to get you 40 or 50 yards and then have to leave the game? Or is he going to be the Dalvin Cook who's going to run for 100 yards, catch 5 passes for 50 yards, and get 2 touchdowns? So, again, Dalvin Cook, I would play him, but he's always a little bit of a risk. So if you do have a lot of good players and you can sit him every now and then, I don't think that'll hurt you. All right, we're going to touch on 2 more players for you this week. The next one is going to be Harrison Butker. Now, why would we talk about a kicker? He's the Kansas City kicker. Well, because they score a lot of points, and as a result, he's involved, whether he's kicking an extra point or they're defaulting and kicking a field goal. So if you were watching 2 weeks ago when they were playing the Cardinals, he planted his foot to kick a field goal, and they love showing the slow-mo. His foot went sideways, so he had a big inversion injury at his ankle. And that's a tough thing for a kicker. He can't tape that thing up. He can't lose his flexibility, or he can't do what he needs to put a ball more than just an extra point away. So he is going to be a sit for this week. His backup will get points, so I would play his backup, who I believe is Amendola. So I would play Amendola if you need somebody to fill in. I think Butker will be at least 1 more week. It is a low ankle sprain, so I think they're just letting it heal appropriately before he comes back. All right, let's finish up. It's a small injury, but we always care about small injuries in wide receivers. We're going to talk about Tee Higgins from the Cincinnati Bengals. So he has, unfortunately, a little bit of an undisclosed toe injury. So whenever we hear toe injuries, when Shannon and I talk about these situations, the first thing we worry about is the dreaded turf toe. A turf toe injury is where you hurt the tissue on the bottom of your foot, right at the base of your big toe, and you need that to push off and run. And that's the injury that basically ended Deion Sanders' career later on, because he had a turf toe that got so bad he just couldn't push off, lost all of his explosiveness. So Tee Higgins, it looks like this is just a small sprain and it's not going to be a turf toe injury. So I would play him if you have him this week, but if he goes out again in this game, I would drop him from your team and look to get somebody to fill that spot, because he may be heading to a legitimate turf toe injury that's going to really take him out of service for 6 or 8 weeks. So I want to thank everybody for putting up with having to just listen to me today. This has been our 2nd week of the Start or Sit podcast. Shannon will be back with us next week, and you'll probably get a little more entertainment out of it. But thanks again, and we're happy to have you all, everybody listening in.